Welcome to Aspen Ideas Health. I'm Dr. Judy Monroe, President and CEO of the CDC Foundation, and it is my pleasure to have all of you join us today for this urgent and critical discussion on the health impacts of our changing climate and preparing our communities to address these challenges. Those of you not familiar with the CDC Foundation, we were created by Congress as an independent 501c3 to help CDC and public health do more faster through forging public-private partnerships to fight the threats to health. And thanks to our donors over the years, we've been able to meet our mission in many ways. Most recently, with the pandemic, we have been solely focused almost on helping with the response. We are shifting our focus to climate and health, this critical discussion that we're going to have today. We are extremely grateful that Elizabeth Cohen, CNN's senior medical correspondent, will be moderating this important panel. Now, I had the opportunity to meet Elizabeth last week in preparation, and I learned that she remembers as a child her parents joining the 20 million other people that attended the first Earth Day. And that left an indelible mark, an impression on her as a child. So as you all listen today, I ask you, what indelible mark are you leaving on your children or grandchildren as you take on the issues of climate and health? So with that, Elizabeth, to you.
Thank you so much. The first Earth Day was 1970. I remember my parents coming back from the events in Boston they went to. I was 5, so you all can do the math. But while you're doing the math, welcome to Aspen Ideas Festival. We're so happy to have you here and so happy to have this illustrious panel of wonderful scholars, experts, and women. Not a dude up here, right? And we're here to talk about the intersectionality of climate change and public health. You all have full bios, so I'm going to do very brief introductions. The first one I think might actually be the briefest. Dr. Rochelle Walensky, Director of the CDC. Leah Thomas, who is an author and environmentalist, and Marlene Wolf. Hers is the longest, I have to actually read it. Assistant Professor in the Department of Environmental Health at the Emory University Rollins School of Public Health. There
Long
we
name,
go.
yeah.
So we're going to start with Rochelle. In true Aspen fashion, everyone goes by their first name. So we're going to start with Rochelle. People know about climate change by now, even people who aren't, this isn't their area. I don't think that people realize that there is an intersection between, we know that climate change is hurting the earth, how is it hurting our health?
First of all, delighted to be here, delighted to share the podium with you and all these incredible women, and to have this conversation about climate and health. I think we need to acknowledge that climate and health is going to be one of the great challenges that we have to face in the 21st century. I don't really believe that everybody recognizes this intersectionality, so it's important to have these conversations. I think we all sort of understand there's air pollution that will lead to cardiovascular disease and respiratory disease. There are issues like heat stroke, and that leads to 700 deaths a year and many hospitalizations. But issues that, tragedies related to drought, flood, fire, waterborne outbreaks related to flooding of wells, for example, tick-borne diseases, vector-borne diseases that have tripled in frequency and come earlier in seasons and broader across the United States related to climate. And then, of course, there's the food security issues. How is our food supply? Will people, our wheat supply, our seafood supply? And then finally, the mental health and stressors related to climate. So there's a broad breadth of all of the intersectionalities, and we continue to face all of them.
And Leah, it's been said that the communities that are least responsible for climate change are the ones most affected by the issues Rochelle just said, as well as other issues. Can you, that's not immediately apparent why. Tell us what's going on there.
Yeah, this is really important to talk about and is often left out of kind of the mainstream environmental narrative. It wasn't until I formally studied environmental science and policy where I realized around 70% of African Americans live in counties that frequently violate federal air quality standards, and that has an impact, as we know, on respiratory illnesses and things like that. So it's really important to consider who is being impacted the most by both climate injustice and health injustice, and that kind of intersection of environmental justice. And time again, it's lower income and communities of color, and also women. So it's really, really important to talk about who is being impacted the most. We can't just say health and environmentalism are connected without acknowledging that Black, Indigenous, people of color, women, and low-income populations are bearing the brunt of environmental injustice.
And how do we see that now? I mean, it's taken shape now, unfortunately.
Yeah, so I guess there's various ways. When I was studying environmental science and policy, it was my GIS class, so Geographic Information Systems. I love it, I geek out about it. And I was the only Black student in my program. And I kept looking at readily available data, everything like tree coverage or air pollution or where toxic landfills and waste sites were located. And for each and every one, it was the same communities, Black and brown and low-income communities, unfortunately, for not just one or two environmental injustices, but almost all of them were bearing the brunt of these issues. So ignoring it is really problematic.
Mm-hmm. Mm-hmm. Absolutely. Well, thank you for that. Marlene, you have, we talk a lot about what will happen with climate change. You know, if we don't sort of get it together now, our great-grandchildren are going to suffer. But to sort of piggyback off of what Leah just said, what are we seeing now? Mm-hmm. What effects, health effects, are we seeing now?
Yeah, we don't have to wait to look into the future to be concerned about the impacts of climate change. You know, all of the health effects that were just mentioned are things that are happening now. My focus is on infectious disease, and so that's where, you know, all my examples tend to come from. But I think about, you know, the way that infectious disease outbreaks are increasing across the world, and they have been for years. Emerging infectious diseases are increasing. And this is much more salient to people now that we've been through 2 years of a pandemic. You know, when I would say this sort of thing a couple years ago, it was kind of like, oh yeah, we'll worry when we get there. We're here. You know, we have more things that are coming up. We have more and more outbreaks that we're going to, you know, need to combat in the future and that we're dealing with right now. And so for us to be able to come up with new, nimble, inclusive systems to track disease outbreaks, understand how infectious disease is impacting people around the world and how it does so inequitably is extremely important. We have, you know, vector-borne diseases, the distribution and timing of those diseases is changing. Increased flooding events are really important with the increased frequency and intensity of extreme weather events. You know, we have displacement of people. When people are displaced, they frequently end up in conditions that are very conducive to the spread of infectious disease. So the ways that even just this one topic of infectious disease is impacted from nearly every angle by climate change is just, it's enormous. And so I'll say one of the things that, you know, I say we need creative solutions. One of the things that we've done in my group over the past couple of years is focus on using wastewater to track infectious diseases. So we can take less than a gram of solids from wastewater. And when I say solids, I mean, you know, fecal solids from wastewater. And we can tell, you know, what is the burden of disease in a community. That started with COVID because of the demand from the pandemic, but now we're expanding that into all of these new threats that are coming. So that kind of innovation is needed now, and it's needed into the future.
Can you talk about the connection between climate change and infectious diseases? Because I don't know that that's immediately apparent. And maybe explain it and give an example.
Yeah, sure. So, I mean, one very simple example that also kind of touches on some of the issues of how people are disproportionately impacted by climate change is flooding. I mean, we have flooding events that are happening more and more frequently now. Those 100-year floods are no longer 100-year floods. They're happening more frequently. We have frequent, intense rainfall events, and we've got, you know, for example, you know, I'm in Atlanta. We have communities in Atlanta where you have a combined sewer overflow system and you have flooding that's happening, and so that means you're going to get in a community that's situated next to that, you know, combined sewer system and next to a bunch of highways and doesn't have good drainage because of the way the infrastructure is built. They're going to come into greater contact with harmful pathogens that are in the floodwater and then can even end up in drinking water. That right there, that's climate change that's creating an impact on individuals who have sort of a systemic, infrastructure working against them in the face of climate change. That's just one example of many.
Did you want to add to that?
I was just going to say, I practiced infectious diseases for 25 years in New England, and every season we would have patients that were triply infected by the same tick with Lyme, Anaplasma, and Babesia. They had all three from a single tick. We are now seeing from our Division of Vector-Borne Diseases that is based in Fort Collins, triple the amount of Lyme, and it's coming earlier in the season, and it's going westward, and it's moving southward than we saw just a decade ago. 9 new pathogens in the last decade related to vector-borne.
But what's the connection with climate change to that?
Well, so the ticks may be migrating, the ticks, the weather may be allowing the ticks to migrate. Deer migration, the different, the sort of conspiracy of numerous things coming together because of the change of climate that allows these ticks to survive and allows new pathogens to emerge.
That's between what the two of you just said, the word conspiracy, it's sort of this perfect storm.
Yeah.
It's not just sort of one thing then another.
Absolutely.
It's that one thing causes this, and it all sort of comes together. Am I getting that right?
Absolutely, and another example is dengue. In the 70s, dengue was in 7 countries maybe, and now it's in 100 countries. And that is for a lot of reasons that have to do with human migration and other factors, but it's also because of the ability of that vector that carries the virus to breed in many, many more locations. So that there's a lot of factors that come together here, but it's amazing. Even, again, we're just talking about infectious disease right now, because I know we're both, infectious disease people. But, I mean, that's just one area, and there are many ways that climate impacts infectious disease alone.
I'm going to do something a little bit different, which is intersperse my questions with audience questions. So we'll take a few questions from the audience, and then I'll go back to answering questions, because you guys might have some questions just based on this. So I think, are there people with microphones here? No? Oh, wait, there we go. Gentleman with microphone. Oh, you're not ready. Okay, then I'm sorry. I should have told you that before. That would have been good, right? Okay. So I will keep going. All right. So we've talked a bit about the impact on infectious diseases. Can you talk about another area of medicine where you see an impact of climate change? Why don't we start with you, Rochelle? I mean, I know you're an infectious disease doctor, so you don't see people for other things. But do your colleagues talk about this?
Yeah, I mean, I think one of the areas infectious diseases, waterborne diseases, but one area where we've worked is food security. So the Sitka tribe in Alaska relies on shellfish for food security. With warming climates, warming waters, that shellfish gets contaminated, and all of a sudden they have real food security challenges. So it feels like it's like a concentric circle out, but it's immediate need, and it's, we at CDC are doing a lot of work to prepare for, respond to and recover from all of the climate-related issues, but this is one where we're working with the Sitka tribe to be able to monitor their seafood supply. If they can't monitor, if it's contaminated, they have a real food security challenge.
And Leah, in the communities that you've looked at, are there any particular approaches that you think would be, if I gave you $1 billion and said, Leah, do whatever you want with it, what would you do with it that might affect the communities that you've worked with?
I love this question because, unfortunately, environmental justice-based organizations, especially ones that are led by Black folks and people of color, receive less than 5% of philanthropic funding in the environmental space. So the grassroots work of organizers that are trying to work on intersectional environmental issues that are impacting health and people of color in low-income communities, they don't have the resources. However, many of these communities, they are the bearers of their own solutions. They know what needs to happen. They know the strategies to improve their communities, but there is a serious lack of funding. So I would say wealth redistribution and getting that funding to those grassroots BIPOC-led organizations is a step in the right direction.
I love that term, bearers of their own solutions. That is a great term. Can you think of one in particular, like a bearer of a solution, and who that person, I mean, you don't have to name them necessarily, but sort of who that person is and what that solution might be?
I would say someone that I look up to very much. So she's no longer around, but her name is Hazel M Johnson. Does anyone know Hazel M Johnson? So she's the mother of environmental justice, and she's from Chicago. She was an incredible Black woman. And because of her work, she identified that a lot of Black communities in the United States are surrounded in what she called a toxic donut. So that meant that they were surrounded by toxic waste sites and landfills, and they also had poor air quality, et cetera. And because of her work and the work of folks like Dr. Robert Bullard, who is the father of environmental justice, we have that field of study today. So there are so many people like Hazel M. Johnson and Dr. Robert Bullard that I think in the environmental community or health community, I'm more of an environmental person, that if there's one person that you walk away knowing their name, I hope it's her, because I hope in the future we can recall people of color who have created these fields of study as easily as we can recall people like John Muir, et cetera.
Michelle, the CDC is so huge, and there are people who are, as I'm going to borrow your term again, bearers of their own solution. How do you know, the CDC and the NIH usually give money to large institutions, to universities. How do you get that money to them?
And that's exactly the kind of work that we're trying to do. So first, let me just articulate much of what, and repeat much of what Leah has said, which is, communities of color, when you look at even just cities that are experiencing extreme heat, you can see differences by 10 degrees if there's asphalt versus if there's greenery or tree cover. Communities that don't have air conditioning are likely to be the ones that are going to suffer from heat exhaustion. So how can we work with those communities and prepare those communities for what may be coming? We now have a new heat and health tracker that at CDC that can sort of demonstrate where we are right now, track hospitalizations, track heat, and what will be anticipated to come. We have counties in Oregon, for example, that we're working with to have many jurisdictions coming together, anticipating when there is going to be a heat challenge, demonstrate where there are cooling centers, talk to low-income communities to discuss, to do outreach and communication. Where are those cooling centers? Also people with disabilities. How do you get to those cooling centers proactively rather than reactively when you're really in challenges? The other thing that we've put together is building resilience against climate effects, our BRACE framework, which is a 5-point framework, which we bring and deliver to communities to say, where are you in this framework about your vulnerabilities to potential climate effects, and where do you need to bolster along this framework so that you can be better prepared for a climate challenge that is headed in your direction. We don't have the resources to do that for all communities. Maybe one final thing that I think is really a challenge, and I'm delighted to share the podium with two people who are younger than I am, I'm sure, is that our workforce, our public health workforce, needs to be upskilled and more versed in this dialogue. And we have a lot of work that we need to do to bolster the next generation to be better about talking about this than perhaps the current generation has been.
Or would we be good for, okay. Raise your hand, and I will, okay, great, sorry, there you go.
She has to call you. Just a quick question. You kind of brought up the COVID pandemic in the context of climate change, and I'm just wondering if you actually see a direct link between climate change and specifically SARS-CoV-2 outbreak.
Where people gather, certainly when there have been disasters or floods or hurricanes and there are people gathering in shelters, that is certainly a challenge with regard to controlling both preparing others or having others recover and trying to do so in the context of a mass vaccination or when there's an outbreak in a community. That is one example. Certainly respiratory pathogens tend to thrive in more drier environments where they can hover for longer. So I do think that there are intersections in all of truly infectious diseases and climate. Do I think necessarily that the origins of this, and probably another discussion altogether, are related to climate specifically? No, but do I think that the challenges of the intersection of climate and health and some of the downstream manifestations or challenges that we've had in tackling this pandemic, there are definitely intersectionalities there.
Yeah.
And wastewater has been a gift from.
Yeah, I mean,
SARS.
I was going to say I'm the one who brought that up, so beautifully stated, but I completely agree. I think, we know that there are many new infectious diseases that are coming about now because of climate change, and then there's also how we interact with those infectious diseases once they have entered the human population. And so that's, the effect of climate on how we manage COVID, I think is absolutely part of the story. And yeah, I mean, one of the things with wastewater is we are trying to use this new strategy. It's not a completely new strategy, but we never really realized we could use it for a respiratory pathogen before. And now we've expanded into we can use it for influenza, RSV, and we're tackling many other pathogens that can be tracked through wastewater and building this durable infrastructure to say, well, we're going to have the ability to take one sample that represents a whole community, represents everyone in that community, regardless of their access to the healthcare system and whether or not they have access to individual testing. If you're connected to the sewer, which 75% of Americans are, then you will be represented in that sample. And so that's one way of adding to the tools that we have to understand where these diseases are impacting people and be nimble to look at new things as they come up, which we know that they always do.
Who knew there were such treasures in sewage, right?
Yeah, it's a gold mine.
Yeah, it really is. It really is amazing.
Foodborne outbreaks too.
Yes.
Any other questions?
Hi. Oh, sure. Yeah. My name is Karen Landman. I'm a health reporter at Vox, also based in Atlanta, so nice to see so many of us represented. I understand that the solutions to the problem we're talking about are going to be different in different localities. And I also understand that local public health officials are already really strapped for resources, both human resources and financial resources. I wonder if there is anything, especially anything that's cost effective, that all localities in the U.S. can do from a public health standpoint to address some of the health fallouts of climate change.
Maybe I'll start and just say, I think prepare is really the big one. I think right now, there is going to be sort of a confluence of potential challenges we have, whether we have intersections of heat and fire, other intersections of health. But I do think being prepared, and many public health departments are not yet versed in how to be best prepared. What do they anticipate are going to be their public health challenges? Working with Minnesota, for example, in looking at they're very committed in one of their communities to well water. Many of their communities use well water. If there's a flooding event, that well water will get contaminated. How do you understand whether there's well water contamination in that community? Now, that's not one size fits all. That's very local public health. But using this BRACE framework, people can really start to understand within public health with a well-versed workforce what are the challenges that they are going to have in their specific community, and how can they work to prevent them in the future?
The gentleman in the back in the corner.
Thank you. So I'm guessing there's probably a lot of people in the audience who, like me, are pretty angry with policy in this country today. And so one of my big frustrations is that we can talk about all the data, and I'm guessing most of the people in this audience are already convinced that climate change is real and all these things are real issues. But our policy doesn't match that reality in any scope that I'm seeing right now. And so what I really want to have is a discussion about how we can get policy to match reality, and hopefully you can give me something to be hopeful about. Because if you're anything like me, it's pretty depressing where a group of people in black robes can make a decision that outweighs what thousands of white coats and scientists have kind of figured out over the years. And I'm seeing the same with climate change. So help me be helpful or hopeful, and give me something to actually show that after the next 2 years, when maybe politics change again, that we won't go back to descending to a reality that doesn't really comport with facts and data. So I'm hoping we can have that discussion.
So I hear two questions in there. One is a question about policy, and the other is a question about please help me be somewhat hopeful. So which are two very important and very different questions. Let's take the policy one first. Would any of the three of you like to talk about that?
I would say, as an activist, to be completely honest with you, my faith in the federal government is low, especially today. It is a really hard day in the United States, and I think we should acknowledge that as we're sitting here right now. But I do have a lot of faith in grassroots local organizing. I have a lot more faith in local governments and state governments, et cetera. And the only thing that gives me hope is volunteering with those grassroots local environmental efforts, because I've seen community gardens be built. I've seen hydroponic, really cool community gardens be built. I've seen amazing tree planting initiatives to help improve air quality and tree coverage, et cetera. But I can't give you the answer that you're looking for, and I think that's something that we collectively need to figure out together. But the only thing that gives me hope is that my ancestors had hope. My great-grandmother had hope. I am so grateful that I still get to live with 3 incredible generations of Black women who still have smiles on their faces after fighting through the civil rights movement and more. So they give me hope, and if they can still smile and experience joy, then I can, and I hope that you all can too, even on days like today.
You're making my mascara run. Yeah, that was so beautifully put. It is never a good time to give up hope. It's never a good time to give up hope. Would either of the two of you like to talk about either policy or hope or both?
It's hard to add to that, but I'll just say these public health issues are connected, right? We know that these, whether it's all of the different ways that climate change interacts with public health and infectious disease, whether it's women's health, like all of these issues are connected, and they all disproportionately affect certain groups of people more than others. And so I think that that's important to keep in the front of our minds, that whatever sort of avenue that we influence, making sure that we are doing so in a way that is inclusive and equitable and prioritizes people who are disproportionately harmed, that should be our goal. And so, my area of focus is infectious disease, right? So my goal in the work that I'm doing is to say, how can we make sure we look at the exposures that are disproportionately affecting certain groups of people? How can we make sure that we hand information back to communities on what is going on in their neighborhood, what they're facing in terms of risk and burden of disease, and again, empower and work with these grassroots organizations to say, we can advocate together for the changes that we're hoping to see. So.
And Rochelle, as you mentioned the Sitka tribe in Alaska, you mentioned counties in Oregon, various places. As you folks work with them, what hope do you see sort of coming from those communities and the work that they're doing?
Yeah, I mean, they're engaged, right? Mm-hmm. So you sort of put forward a framework of how they can work to prevent, and they're engaged, and they want to be helpful. This is a hard time in health and in public health. We are working at CDC to bolster the whole infrastructure of public health, whether it be workforce and how we upskill our workforce in this area, data, so that we can actually not only look at health-related data, but how does that intersect with transportation and agriculture and housing and urban development and environmental equity. So we're looking at how we can use all the data and laboratory infrastructure. How do we use that to use wastewater? It's a hard time to get resources for public health. People are kind of done with investing resources in public health. That doesn't mean we're going to stop. But I'm energized because, first of all, we're having this conversation. And we have a National Center for Environmental Health led by the great Dr. Pat Bricey, who is been working for a decade in this. And when we came together as an agency to say, what have we been doing at the intersectionality of this as an agency, there were tons of people at the table, tons of people energized in our vector-borne diseases, our Center for Global Health, not just in our environmental health. So I'm energized and hopeful because we're having this conversation. I'm really energized and hopeful by our youth, because when my son was in kindergarten, he was yelling at me that I wasn't recycling enough. And that's true, right? So that it is our youth who are much better versed in these conversations than I think we have been, and who I think are going to be leading the charge with this. So thank you.
So I'm going to ask a cynical question. I'm going to be Eeyore for a minute, and you guys can tell me why I should not be such an Eeyore. I am no expert on climate change, but just as a non-expert, what it feels like is that these problems are caused to a large degree by industries. And as the gentleman pointed out, there have not, the efforts to change policy have not always been so successful. And so, sure, I'll do what my kid says and I'll recycle. Is that really going to make such a big difference? Or the hydroponic gardens, or any of that? If those guys, the big guys at the top who fight policy change, I mean, not that all of them do, but many of them do, if they won't do what they should do, is anything else going to move the needle? Who wants to address Eeyore?
I love this, especially because my nonprofit, Intersectional Environmentalists, two of our core pillars are climate optimism and then also radical imagination. And radical imagination is all about imagining the future that you want to see. It's really important to understand the systems that you'd like to dismantle and change. But I would say once you understand those problems, and I think many of us in this room understand those problems very deeply, is to spend a lot of your time radically imagining what a better future could look like. But to answer your question more specifically, this happens in the environmental movement a lot. There's kind of an argument between individual change versus systems change, but it's not a versus issue here because individual action does lead to systems change. So those things will compound and hopefully systems will change. So I don't want to discourage people from doing those individual actions because of course corporations need to change. But I think our individual actions can lead to community action, which can hopefully lead to systems change. So I have to believe that to keep doing this work. So sometimes it takes some mental Olympics to get there. But yeah, that's what I've got.
Yeah, and I think, you know, we are, a new generation is coming in that is pushing us on these issues, right? I mean, we have in our MPH program, so many students who come in with this desire to specifically work on the environment and climate change and health. You know, in a public health program, so many students who specifically want more and more resources to talk about environment and to talk about environmental policy, right? You know, they're coming into a health program and they want to talk about environmental policy. And they are being trained to be that next generation of leaders. You know, I have a backyard garden with my kids, right? And they plant a little seed and now we've got a huge tomato plant and they get to pick and eat those tomatoes. And they're getting that experience. If we can put that into our culture, the experience of intimacy with the environment and appreciation of the environment and individual actions that not just make a difference drop by drop, but also inspire a culture of change and new leaders who will continue to push us forward. I think that is hopeful to me.
You know, I think we learned a lot through the COVID-19 pandemic about the Swiss cheese approach to prevention. And so individuals alone will make some difference. They will not make all the difference, but they will make some difference. And so this Swiss cheese approach to improving climate and health, I think we are going to have to be at as well. We have a lot of individual action. Those individual actions do congeal to community action, which those community members are part of organizations. I was been part of conversations of we need to buy freezers, we need to update our freezers in this big health system. How are we going to purchase environmentally friendly freezers for this big health system? So those conversations are actually starting to happen in big financial systems. Sometimes they're you know, a financial hit for them, but not always. And increasingly when, if they're not motivated by the climate and health issues, they will be motivated by finances. And I do think ultimately there will be issues related to the finances that will move them in the right direction.
And Leah, we talked when we all spoke before about the, traditionally public health solutions often come from on top. They're studied at the academy and papers are written and published and, everything sort of trickles down. But this feels different. And so can you talk about what young people are doing with social media and without to sort of make that, not get rid of, but to do a different approach than just from the academy?
The youth are so cool. I like to say that I'm Gen Z adjacent because I'm 27, but I guess it's Gen Z-ish. But yeah, the way that they're using social media and TikTok to talk about things like environmental justice, and they're reading really cool reports, and then they're making 30-second videos to talk about, did you know that air pollution in this community, or did you know that there happens to be, the water in this community is really poor, and then it's getting shared millions of times across TikTok. So then what we're seeing is then there are a lot of students who are saying, why am I not being taught this in my neighborhood? Why do I not know anything about environmental justice? So TikTok and Instagram is helping change the way, so students are going to their teachers and professors and they're saying, I want to learn about this. And it's really, really cool. So they're subtly influencing their own education, and they're taking their education into their own hands, and they're breaking it down in ways that are really accessible. So I think it is really important to also combat climate misinformation and to make sure that the youth are getting really great information to be able to share in those micro content videos, but it's pretty cool.
Do you see climate misinformation in social media the way that you see anti-vaxxers saying all sorts of word I won't use? I mean, does that happen with climate change?
It does more on Facebook, I would say, but Pinterest is the only social media platform that has a climate misinformation ban. The other platforms do not, and probably should catch up. But you see climate misinformation happen a lot, especially on Facebook with older generations. Things that say...
What are the old people saying?
Saying things like the planet's okay, or the weather changes, or climate changes all the time, everything's fine. I saw something circulating on TikTok where someone was saying something along the lines of, oh no, all of these greenhouse gases are actually really good for us. So there's a lot of climate misinformation, so I think the next step for a lot of these social media platforms is updating their misinformation and disinformation policies like Pinterest has done to make sure that we can kind of clamp down on that.
Yeah, Pinterest was also amazing with anti-vax stuff too. They seem to really be leading the way. Looking at COVID, we all know how difficult it was sometimes to get people to take certain actions, like get a vaccine, where the cause and effect was so clear, the benefit for themselves and their families was so clear. As you were talking about before, the connection between climate change and your health, there are so many steps, and it's not apparent why combating climate change may keep you from getting sick. So if we struggled with some communities with COVID, where it was just very clear that this could keep you from dying, how are we going to do that? How are we going to explain this connection and ask people to act on it? And I'm looking at you.
Yeah, I think, I'm happy to talk about this. I think that the way we do that is by talking about, not just the big picture of what's happening with the planet, but also the specific threats to you and your family right now, I mean, those are things that we can do a better job of making clearer to people, the connection between some of the things that they are actively experiencing in their daily lives and climate change, whether it is, actual heat or whether it is increased flooding, extreme weather events, pandemics, to make that connection for people and talk about the actions we can take to respond in the moment, I think helps bring us in further and closer to the big picture of what we need to do for the climate as a whole.
Does either of you have any thoughts on that?
I totally agree. I think when you have a new diagnosis of Lyme disease in Wisconsin, make that connection. When you were evacuated from your summer vacation, make that connection. Evacuations happen more commonly now than they ever did before. When you were displaced from your home from a hurricane, make that connection. And as we make those connections, it's very hard to think through a family member who had an emergency department visit for heat exhaustion. Make those connections. It's hard to actually find a family that hasn't been in some way impacted by climate, but those connections haven't been made. So we have a responsibility to make those connections.
It is interesting. I was saying on the call that we had before last week, I said that, when my parents went on an Earth Day march in 1970, everyone thought they were pinko commies, right? Like caring about the environment in 1970 was just such a fringe thing to be, even in their community in Boston. And now it's so mainstream that actually in a way it gets abused, right? Like people use, but that is good. I mean, it is good that the more that people care, the more that their elected representatives start to care. I mean, that's a big change from 1970 to now. So that, I just talked myself out of my earness.
You want some honey?
Yes, exactly, your poo. Let's see, why don't we take some questions? I see a hand over here.
Hi, I'm Jeff Thompson. I'm a pediatrician, former CEO of the Gunderson Health System. I had the great fortune of representing healthcare in the United States at the Paris Climate Talks. If you want hope, you need to look at the arc of where things are going. Big business in Europe cannot get a giant loan from the World Bank, from outside investors, unless they have an environmental policy program that actually is in place and working. In the United States, BlackRock has come out and said, I'm tired of little brochures. I want to see what you're doing. At a recent gathering put on by the National Academy of Medicine, we had Frontline, we had University, we had HHS, we had American Hospital Association, and we had Healthcare Without Harm that has over 50,000 organizations across the world that are working on this. So there's a lot of movement in the right direction. My question for the group is, it's great that Rochelle understands this and how important it is. And there's nothing like frontline activity to really move communities, especially communities of color that are getting beaten up all over the globe. In the universities, they have all the answers. But they're not going to get anything done unless they connect with the government and the front line. So what are you doing to connect the people outside your box? Your box is very important, but you can't do it alone. This is a big thing. You got to do it with folks. What are you doing? Thanks.
Yeah, actually, thank you for that. That was exactly where I was hoping we would go, because we in this room, devoted and dedicated to health, can't do this alone. This has to be cross-sector. This has to be multidisciplinary. It impacts, I mean, we have health-related impacts, but the answers have to be much bigger than health. The prevention has to be much bigger than health. So we are doing a lot across the government, working with Housing and Urban Development, USDA, other places around the government. We talked yesterday about trying to modernize our healthcare data. How do we modernize our public health and healthcare data, our healthcare systems, making them interoperable, while at the same time looking at housing and urban development data, weather data, agriculture data? How do we make those intersections, environmental justice data, and then reaching across our academic sectors, our private sector partnerships? We are doing that through a lot of our work with our Center for Forecasting and Analytics, Outbreak Analytics, but we do need to expand our outreach because we can't be looking down, we have to be looking up.
He gave me an idea, and I'm going to put you on the spot for a minute.
I love that.
Is it possible, in the same way that the groups that he talked about said, I'm not giving you money until I see something, not a proposal, but something in place. CDC gives away lots and lots of money. Is that a possibility for CDC?
It is. Historically, when we have said, we will give you this if you give us that, it doesn't always work. So, and that has happened in our data systems as well. We will, these are the resources, but we are expecting these data in return. We will give out the resources, we don't always get the data back. It's certainly something we could try, but it's not always successful in what we're hoping to get out of it.
So you ask them for it before you give them the money?
Well, we want to sort of see the impact of the resources that we give. So we would say you report on how your intervention worked on A, B, or C, and that has variable impact, but we've tried and we will continue to try.
Gotcha. Okay, any other questions? The gentleman here.
Hey there. Thank you so much for just everything that you said so far. It's been really great. But the thing that I've been really thinking about lately is, probably the worst infectious disease out there right now, misinformation. And I'm wondering, with the rate of spread and everything that we've seen, we talk a lot about prevention when we talk about disease. But when I've seen people try to prevent the spread of misinformation by anticipating what somebody may bring up as a conspiracy theory or some element of disinformation, they end up increasing the spread of it just by saying that thing and throwing it out there in an attempt to anticipate it. They end up giving life to something that may not have even come about if they hadn't said it. And so as a science communicator and a researcher myself, I'm wondering, like, how do we prevent misinformation instead of constantly trying to run down something that's just been said?
That's a big question, even beyond climate change, right? I mean, that's such a huge problem and underlies so many issues.
This is a big question that I feel like we all could tackle, but I think there's something happening in this country and maybe all over the world where people are just starting to question science in ways that maybe they didn't question it before. So I think we can start with the youth again, you know, talking about things like the scientific method and talking about even just breaking it down that certain things are facts and certain things are opinion, but I think we need to just change things in our educational system. But other than that, what do you all think?
I think one other thing is just coalition building. You know, I think that to the previous question as well, you know, how do we make sure that we are kind of building movements that include different groups of people who can speak to the things that we're concerned about, you know? So, like, for example, with our wastewater work, which is an interesting thing to communicate about, right? Because you are taking, you know, everybody's conglomerated contributions into a sewer system and gleaning information from them, and that's something we have to explain to people, and it's something people have a little concerns about. They're like, well, wait, can you identify me? What's going on? And there's a lot of science we have to explain, and no, we can't identify people. It's a great, like, anonymous measure of what's going on in the population. But, you know, we have involved, you know, myself as an academic, this comes from, you know, the research in our group of people at Emory and Stanford who are doing this. But then also working with public-private partnerships. We're working with Verily, working with the National League of Cities to communicate to city leadership, like, here's how we implement this. And then the CDC has the National Wastewater Surveillance System, and so we're able to feed our data back into that to share with everybody. And on top of that, we have our engagement with public health and utilities and the community to get that buy-in. And so it's just, you know, my example of how we, I think, have done a pretty good job. I say we very expansively, everybody who's been doing this type of work around wastewater for the past 2 years, explaining something that is completely new, very sciencey to people, and getting them on board, you know? So it's been a very hopeful experience for me, so.
Maybe I'll just add, this is among the things that keeps me up at night. It's really, you know, we are doing a lot of work at CDC on some introspection about what has gone well and what has not gone so well over the last 2.5 years during this pandemic. And if we knew that there was going to be a planted seed of misinformation tomorrow, are we equipped and empowered to prevent it? We at CDC have communications that are around foodborne outbreaks and, you know, and smoking cessation campaigns. Not really resourced to sort of think about all of communication of science and health and how to stop something nefarious that is intended to spread. And so we're spending a lot of time thinking about how we would up our game in terms of communication and how we can be resourced to do it. But this is a real challenge, and I think it's going to be a challenge not just within CDC, but all of us need to tackle this. With regard to the science issue, I said this yesterday, you know, the implication that because it's with science, it is truth and fact and known is not the case. It is evolving and challenging and gray, and we are learning more, but it is not static. And that is hard to convey in a 15-second soundbite, or I don't even know how many characters a tweet is, but you know, a short tweet. I probably should, you probably do.
She can help you, or your kids. It would have been around 2018, so before you got to the CDC, I did a story with a CDC person, and the headline was, anti-vaxxers are winning the social media war against the CDC, or beating the CDC at the social media war. What the CDC person said to me at the time was, we are not getting down in the mud with these people. We put out our data, we put out our science. We're not getting down in the mud with these people. So, you know, 4 or 5 years later, do you think that's still the route to go?
I think we have to figure out how to nip it in the bud. I think that there's something between getting down in the mud and clearly, I mean, if you just look at what misinformation has done to the vaccination campaign, not just for COVID, but for all of childhood vaccination. We have to do something to tackle it. So, you know, getting in the mud, I suppose, is one way of putting it, but we do have to understand how to get ahead of misinformation and to stop it in its tracks.
Gotcha. Are we done? Seriously? Wow, that was like the fastest 15 minutes. Listen, thank you. You all asked such excellent questions. Really, really appreciate it. And thank you. Thank you.